The first time I attended an IAS conference was 1989 in Montreal. I had tried to go to Stockholm in 1988, but I was unable to do so because I couldn't get funded. It is while I was in Montreal, I got interactions with other people, and the following year actually became a member of IAS in 1990. And then I got involved in the IAS activities because one other passion of mine was to pass on the skills I had acquired as a clinician. So I got involved in training sessions to train young physicians, care workers, particularly from resource-limited settings, on how to manage patients, management of opportunistic infections, manage use of antiretroviral therapy, because at that time it was new. And so I got involved in that. And then in 2000, of course, I became a member of the governing council. I was elected to be one. And so one of the major reasons why HIV changed the way we conceive care is that in Africa, and in Uganda in particular, because the major problem had always been infectious diseases. So when these people came to us with the malaria, with the fever, the first initial decision was that they have got malaria. So you give them anti-malarial treatment. They come back. When they come back, you're a bit surprised. Maybe this is typhoid. So you give them typhoid treatment. They come back. HIV taught us that even healthcare workers can be failures. Before then, we never thought of failing because whatever we gave, if someone has got typhoid, you give him chloramphenicol, they get better. You have malaria, you give him chloroquine, they get better. But now, what they had, we didn't know. We tried everything, it didn't work. So now we started to be more understanding, asking more questions, knowing that we can be a failure. So the communication between the patient and the doctor improved over the years. Today, you go to a clinic, the patient sits, he asks the doctor is willing to answer. Before that, the doctor wouldn't even ask the patient wouldn't even ask the doctor because the doctor is too busy, but I think whatever he has done for me is good. But now, things are different. And also brought in the issue of counseling. HIV has taught us that yes, as doctors alone, we are not enough. We need others. We were aware of the nurses, but even then we were aware of the nurses of taking orders from us. In my AIDS clinic, the nurse, the doctor, the counselor, we work together, and the lab person. And we discuss the issues together. This person, what should we nurse? What do you think? Counselor, what about his daughter? You think he's old enough to understand those issues? These are things of today. They were never existed in the past. And all this is because of HIV disease. I became a president-elect in 2008, and then confirmed the president in 2010 in Vienna. The thing many of us remember at the time was the financial crisis. Surely, PEPFAR was on board, Global Fund was on board, and everybody was happy. Things were running fast. Then came the global financial crisis. To me, it meant that we've been supported, particularly because the Global Fund, PEPFAR, we are the beneficiary in the resource-limited settings. But also it meant that we also needed to pull our socks and be ready for the inevitable, that this funding and support may not go on forever and ever. And that was tough. So my drive was to convince the recipients, the major recipients of this donation and support, that yes, it's good to receive, but also it is important ourselves to increase our own investment in healthcare, not only for HIV, but across the board. But that's investment. But also to use whatever we have obtained, either from our own countries or from the donors like Global Fund and so on, more efficiently and more effectively. Because in one way, that would be the way to convince the donors to continue supporting us. One of the objectives of IAS is to support health workers at the grassroots, particularly the members. And there have been areas of discrimination, not only this time about the patient, but even health workers who are worked into the field of providing HIV, particularly in the countries where the HIV epidemic is mainly among the marginalized groups. The health workers working in those areas have been discriminated, and even some have even been taken to prison. IAS has been a voice for those people, and there have been some successes. In Iran, 2 health doctors were released mainly because of the voice and support from IAS. Also, the other achievement is the support of the younger scientists, particularly in the socially limited settings, who have learned a lot from these conferences and also got support. For example, IAS has programs which are mentorship programs, whereby they help these young people who can seek assistance from various specialists in developing their proposals, developing their abstracts, developing their publications and so on. So that to me is another achievement. The other, I think, achievement of IAS is the involvement and involving the activists and the drug companies in coming to a common ground. For those who are new to AIDS conferences today, they may not be aware of what used to happen in the 80s and 90s, where there were running battles between the activists and the drug companies in particular. Today, there's no conference which will take place without understanding and meeting the organizers, meeting the activists, and understanding the role. Today, we clearly say that if there is going to be a presentation, we anticipate that there's going to be a demonstration. We want the speakers and say, look, put in an additional 5 minutes, because the activists will be given their time to say their notes, and they agree because they pass on the message, and then leave, which is now understood and accepted. And to me, I think that's one of the other big achievements of IAS.